tonight on Focal Point.
An ageing population is something to be celebrated, and that's what we see in the positive ageing message, but it also comes with challenges for our health and social care so that older people can stay at home and live at home and live well at home into old age.
There is a right to be treated as an individual, not because, we worked all our lives and we're owed it.
Wheelchair basketball is a sport for anybody that wants to try out a sport. It's for anybody, maybe somebody that wants to get themselves out of the house a couple of nights a week.
In China with the Great Britain under-25 team where we won gold, it was just the highlight. It's the first time we ever got into the pool games undefeated and got into the final and actually got that World Championship. That was a great achievement.
There is most certainly very little, if any, coordination between the food banks themselves, and we find that the most concerning, because basically you could have a family that's bouncing between different food banks and trapped in extreme poverty without getting the support that they need, and we don't think that that's right, so we're trying to address it.
Today we have a conference where we've invited speakers from England and Scotland and professionals across Northern Ireland to come and hear some of the good practice that's out there in terms of empowerment and reaching the voices of older people, particularly those in care. The issues of dignity and rights and human rights has been the focus of the conference today, and certainly the message coming out is that we can do better. There are a range of measures which have been shown that are in place in England and in Scotland which look like the types of good practice you'd want to see in Northern Ireland. And to do that, it's about making sure that the voice of older people is at the centre of decision making, and that we have a mantra that nothing should be done about me without me, and that's very clearly saying that there's no decision making unless the older person is at the centre of that decision making.
Older people are discriminated against every day in Northern Ireland, and we are the only, older age is the only ground where it's legitimate to discriminate against older people.
Last year we asked about attitudes to older people, experiences of ageing, and we found that about just over half of respondents felt that older people have access to appropriate health and social care. About a half felt that the rights of older people in Northern Ireland are upheld, and a half felt that older people are being treated with dignity in our age. And they're not great statistics, so we only about half of people think that the rights of older people are upheld. So I think that's a kind of a reflection of what the general population thinks.
Older people are known to be very reluctant in terms of making complaints.
Essentially what I was talking about was my partner had, she was diagnosed with Alzheimer's. So my experience of the care package that went into place around that. She died 3 years ago, and she had a very difficult time in hospital palliative care. So I made a complaint after death about under-medication for pain, and which they dealt with very well. Took years to diagnose her with Alzheimer's, and in the meantime she went over 65, and suddenly they wouldn't do psychometric tests because she was old. Now we appealed that, and her Alzheimer's was ultimately diagnosed through psychometric tests, but initially she was too old for them.
Where does old age begin? Some people think it begins at 60, some people begin 65, 70, 80, whatever. Say we think that it begins at 65, somebody could actually live till they're 105, so that's 40 years of their life they actually spend being old. So given that there's a huge diversity of their experiences, their health, their well-being and their whole social situation over that age, then I think obviously our health and social system has to reflect that diversity. So I'd say probably our system is set up, if you look at groups as a whole, it's not necessarily set up to think of the rights and the needs of the individual.
I'm 67. And I imagine my mother at 67 wasn't quite as active as I am. So maybe it's a case of the baby boomer generation, being more active and, hopefully changing attitudes, and that we're more vocal, you're not going to hide behind the chair and not make our viewpoints.
An ageing population brings different needs. The rise in dementia is a clear example where we need our services and our strategies to be lined up so that we can encourage and hope and support carers and those older people with dementia to live well. And that's just one particular area. There are other areas such as diabetes, and for us there are significant challenges which need to be addressed, and they need to be addressed by a clear policy alongside the practice of ensuring that there's a workforce, and our health and social care workforce are the main element by which living at home will be achieved.
What do you think is the right approach in caring for our older people?
Well, I think the right approach to caring for anybody, including older people, is to treat them as an individual and to have a flexible enough system whereby people are treated according to their needs, as opposed to what the system says the routine should be.
We know from our research that 1 in 3 people in Northern Ireland face loneliness and isolation in their own home. Many have said just that they only have the television as their formal means of company, and we're also aware that there's significant levels of poverty within levels of older people in Northern Ireland.
I think society does have a responsibility to look at how far.
Some of the ideas suggestions that came along today actually weren't groundbreaking, they weren't really expensive. So it's really about sort of constantly trying to think how we can change our policy and practice.
The issues keep coming round again, except there's different language or a different perspective on it. So I think the value of today was the positioning of older people's issues within a human rights context, and I think the challenge is for older people to own that language, that there is a right to be treated as an individual, not because we worked all our lives and we're owed it.
An ageing population is something to be celebrated, and that's what we say in the positive ageing message, but it also comes with challenges for our health and social care so that older people can stay at home and live well at home into old age.
The nights have been going for 25 years. We've actually just celebrated our 25th anniversary. We had a big gala dinner and a few fundraisers, things like that. So I've been involved probably about nearly 20 of those years. There's a few guys that are still playing now that started the club way back in 25 years ago, so it's been going quite a while.
Well, I started about 2 years ago, and since then I've loved the sport, got involved with any chance of basketball. I got involved, I used to swim, and it was at a gala that I was approached by the DSNI, people that run the basketball, and they asked me to come along to one of the sessions, and I loved it ever since.
Myself, I started off when I was in single digits, and I was only a pup, and it was suggested actually to my mum for an activity for myself to keep me busy a couple of nights a week, and I just came along to a training session, and ever since that first session fell in love with it, so kept at it. When I was a lot younger, my team actually won the regionals, the UK regionals games, so that was definitely brilliant to get that far in a competition that involved teams from all over the UK.
It's been in the past year that I've been in the Great Britain women's team, and I've been to China, Papendal, France. I must admit, when I was in China with the Great Britain under-25 team where we won gold, it was just the highlight. It's the first time we ever got into the pool games undefeated and got into the final and actually got that World Championship. So that was a great achievement.
We cater for any age group really. I mean, we had a boy who's just joined us this season who's only 4 years old and getting involved with our junior setup, which is great to see. And we have players now that are playing up to 50. So a lot of very fit participants. Probably between 20s and 30s would be where most of our members are in that age group. In
Northern Ireland, we have a good club here with plenty of members. But at the same time, we're always welcoming new people. You know, it's always great to see new people coming in. For myself, you know, I'm 23 now, and for me, I've probably seen maybe 3 generations of kids come under me, you know, and play underneath me in the junior setup as I've progressed into the senior team. And that's nice to see, because I remember being that little pup that was rolling around, you know, 2 foot tall in a wheelchair and didn't know what he was doing. So
there's no real specification. I mean, you can be any, as I said before, any age, any ability or disability, whatever way you want to put it. I mean, we have people here who have, you know, very high back breaks and not a lot of movement, all the way up to we have able-bodied players playing for us and are able to play in the league. So there's no restriction. If you want to play wheelchair basketball, it doesn't matter what your background is, you can come and play if you want. The only restriction is internationally. If you want to play international, you have to have some form of disability, but that can be a minimal disability. You know, you can, as long as you are incapable of playing the running game, then you can play wheelchair basketball internationally.
Would you like to see more women players?
I definitely feel left out when I come to some of the training sessions. It would be good to see more women, female players playing. But I'd say it's quite low in popularity. Like not a lot of people have heard of many wheelchair sports, never mind wheelchair basketball. So I'd like to see the increase.
Being in a club like this and being surrounded by people that are in a club like this, brilliant. For anything, any aspect of your life that you want to improve on, you can do it here.
I think it's grown fantastically over the last 25 years. Hopefully we can keep going for the next 25 years and more. It is a very exciting and very fast-paced sport, and it is available for everybody. We have our own Facebook and Twitter if you want to follow us on those, and we have our own website as well. You just put Knights WBC into Google. They'll be able to find our website, and as I say, you can follow us on Facebook and Twitter, and the more people doing that, the better.
The Belfast Food Network has been looking at food poverty now for almost 18 months. The first phase of the Enough is Enough project was creating a baseline study of what's basically happening around food poverty in the city. So we got the facts and figures and stuff in place. And this event was a follow-on from that. So we took the information about what's happening, and now we're trying to build on it and turn it into an actual response.
What exactly is food poverty?
For me, it's when somebody can't afford to eat. It's as simple as that. You know, there's not one single definition that anyone can agree on. There are many. But if you can't buy yourself a meal, that's food poverty. If you can't share a meal with friends, that's food poverty. If you are forced to eat a really bad diet because of where you live, that is food poverty. It's a very big issue.
Food poverty, in our view, is an increasing problem. I think we always say when we're talking to people, we say it's not about what's happening now. It's what's been happening continuously over this past 5 years in terms of the squeeze on people's incomes, the cutbacks on the social security budget. People have less money to spend and to feed themselves, and so in our view, it's increasingly difficult and only going to get more so. We heard the Chancellor announce cuts to tax credits. We're all going to feel that coming in the spring. More and more difficulties with that, including food poverty.
I work with cities throughout the UK, more than 40 cities who are working to tackle food poverty and finding particularly solutions beyond the food bank. What we're finding is that just like in Belfast, cities are really overwhelmed with the numbers of people struggling to put food on the table for their families, and are trying to develop innovative solutions locally to make sure that everyone has enough to eat. I think one of the biggest issues is for families with children. We know that the rates of child poverty are much too high. We need children to be eating a hot, healthy meal at school, but we also need to make sure that there's enough provision during out-of-school time, during the summer holidays in particular. We know that many parents are going without food so that their children have enough, and even that children are skipping meals. So we really need to make sure that children are participating in free school meals where that's offered at school, and that they're getting enough to eat during the holiday time when they're not in school.
So what we've done is we've picked 10 key areas, and we have asked the groups over the last couple of hours to work out exactly what they need to do in order to make that a reality. Some of them, for example, were community gardens, low-cost cooking, access to advice services, stuff like that. All of the information is going to go back, be put into a report, and the Belfast Food Network will push for its delivery to try and get some change on the ground. We just want everybody in the city to have equal opportunity of choice. Everyone can choose whether they're going to have a good tea or a bad tea, but it would be nice to know what the difference is.
When we're talking about this issue of food poverty, can you tell me about some of the work that's going on in your community, some of the work that you're involved with to sort of tackle this issue?
My work at Hosford involves sourcing in food from the likes of Fair Share, and we supplement that with food that we grow in our own community garden. So we have a community garden owned by East Belfast Mission at Skynos, and we grow everything there. We grow herbs, we grow food that you can grow in Northern Ireland's climate, so things like leeks and parsley and celery and things that you could use for a pot of soup. The food that's grown there is then cooked at a funded project we have, building the community pharmacy project with our local pharmacist, and we cook a healthy, nutritious meal there with around 20 of our tenancy support clients. So they're clients that we're preventing become homeless, and also we mix that with folk come in from the hostel as well, so that they're at least getting taught once a week how to cook the food that we're growing.
We're doing very practical things, like we've 3 community garden sites in North Belfast. We're running an older people's project, so we grow a lot of food, and then we share the food out amongst each other, and people go away with, during the growing season, they go away with a good lot of vegetables and flowers actually during that time. But I suppose it's really about raising the awareness about food poverty and the issues people face by not being able to get access to good fresh food, and for it to be, I suppose the big thing that has appeared to us and become apparent, I suppose, is that it's cheaper to go and buy a full meal in Iceland than it is to prepare and cook something yourself, and that can't be right, because people can't afford sometimes to actually cook it and put on the cooker for that amount of time. So it's a big issue, and it's facing everybody.
Advice NI, we're a membership body. We've got about 60-70 organisations across Northern Ireland, independent advice services providing advice to people on social security and so on. Increasingly over this past number of years, more and more people were coming in and saying they simply didn't have enough income to feed themselves. Basically, they weren't able to put food on the table, and our advisors were saying to Advice NI, well, what are you doing about that? You need to do something. So our first step was, back in 2013, was to do some research through our advice centres around the numbers of people who were needing to access food banks, who were suffering from food poverty, and the number of food banks that existed at that time. So we published a report called Enough is Enough, and that has got that detail in that, and that was the start of our involvement, really.
The Enough is Enough report is available on our website. It's just on our homepage. It's actually 32 pages long, but the key points are that Belfast has now got 10 food banks. This is a tiny city. 10 food banks is not okay. It's very far from okay. It's an extortionate number for a city of this size. We know how many people are accessing them. It was 9,000 people over an 18-month period, which is terrifying. The highest proportion of people who access them are working. Families who go out to work and can't provide for their children is very difficult to accept. The only real thing that can be done about that is active promotion of the living wage. And yes, the minimum wage is going up slightly, but it's not enough. It's absolutely not enough.
Sammy Wilson releasing a press release before this event praising the good work of people working in food banks, and at the same time saying that unfortunately it's just a fact of life that people will have to use food banks. That's not the truth. It's an unfortunate fact of policy, an unfortunate fact of the failure of our ministers and our government to mitigate what drives people into food banks. One of the big things that does that are sanctions at the welfare office, and that's not someone having a pound taken off them, that's them having their entire benefit taken off them for being 5 minutes late, 5 minutes early, not attending an appointment, not filling in a letter properly, or these brutal and horrible work capability assessments which are driving disabled people onto job seekers benefits by declaring them fit for work after a tick box exercise and not listening to medical evidence.
So what we've got to do is take it to the minister responsible and try and get all these sanctions stopped so as these people are not put on the poverty line, are not pushed into food banks like this conference is all about this morning. I mean, we're here to support this conference because we know what the sanctions do to the people that's unemployed, and 9 times out of 10 it's the most vulnerable people in our society. People with learning difficulties, people with little or no education are getting sanctioned because they can't read or write, so they don't know what the forms is being sent to them. And to me that is an absolute disgrace, because someone should be helping them fill in these forms, and unfortunately there's no one in the offices to do that.
Up to now, I think there has been some amount of spin and PR around, it's the work shy, it's the people on benefits, but it's becoming, and the government are finding this, it's more and more difficult now for them to justify what they're doing, because there's people that are going out to work and trying to earn enough to go their own way without being reliant on benefits, although they do need the tax credits to supplement their earnings.
I think that we need more partnership working here in the greater Belfast area. I think we need a driving force, whether that's the Belfast Food Network working in partnership with Belfast City Council, who I think have a responsibility to provide this for local community, but it has to come from the bottom up as well. There has to be a hand in community and people passionate about carrying this work forward.
There is very little coordination between the community organisations that give out food parcels or refer to food banks or give lunch clubs or after schools clubs or provide holiday hunger activities, stuff like that. There's no coordination of it whatsoever at the moment. There's no coordination at all at a citywide level of the community gardens, of which is a huge resource that we should be using far more wisely, frankly. And there is most certainly very little, if any, coordination between the food banks themselves. And we find that the most concerning, because basically you could have a family that's bouncing between different food banks and trapped in extreme poverty without getting the support that they need, and we don't think that that's right, so we're trying to address it. Nearly 100 people were here today to try and work on a collaborative response. That's really where we're going with it. We need to turn this into positive actions.
This is an interesting group. It's bringing together people from the public sector and from community voluntary sector to look at it. But we can't kid ourselves. This is an issue for government. Government have to tackle poverty. I don't think they fully realise what people are facing on a day-to-day basis. And we can do stuff around the edges, but we really need to get the politicians to hear what people are facing, and then to challenge things like, the welfare reform, and also to have the living wage, because there's a huge number of people in poverty because of sanctions, but there's also a huge number of the working poor, and that has never really been the case. If you worked, you were able to provide for your family. Now that's not the case. You're working, and you're maybe working 2 or 3 jobs, and something happens, goes wrong, the washing machine breaks, that's you, and you could be facing food banks. It's not right.
I think the issue of food poverty affects communities in a wide variety of ways, and events like today, where groups working in a variety of different sectors coming together, I think that is the way that we need to move forward. But food poverty can't be solved at the local level. The key drivers of food poverty are low wages, delays in benefits and sanctions, and those really need to be addressed at Westminster.